Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter NCLEX review in the Zen RN Study Group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece. So take a breath, open your notes, and let's make the NCLEX feel a little bit less overwhelming. Let's do it together. Let's get started.
So we are in a new chapter about NCLEX questions practice regarding the chapter 19. So let's talk about infection and immunity in this chapter. I hope you know the chapter 19 from the overview outline, because the question is based on that chapter. And please stay curious, stay informed, and keep learning. I hope you like, I hope you share, I hope you subscribe. And let's move forward. So as you see, when I record, it's we are end of September in 2025. And this made me to make about this NCLEX because it's a lot of people are talking about NCLEX, that it's hard and how they failed. And this picture that you see, I will take my highlight. So you see this, it was made in June 25, was posted in one of the Facebook about NCLEX, and this person said like please recommendation, but there are another candidates that had failed this NCLEX more than 2 times, and I want to know actually why. Nobody says why. I just want to know that because I am in California, so here in California we do a lot of stimulation and you are in kind of exam mode, not mood. I'm not in the mood. Mode to mimic the NCLEX. Doesn't matter if it's a one chapter. Is it just that you concentrate about some questions? Usually it's better to have more questions. It's good to have like 100 questions, and then you'll sit down for like you put a timer for like, I don't know, 1.5 minutes for each question. Usually it's better. Well, I know ATI, it's very stingy, 1 question 1 minute, so that I really don't like. But I think they just want to make you in that mode of exam that you need to go, not kind of let's sit down and just talk about it. No. So this here, you see here on the red, it's the one that I always talk about, and very good on here, but the yellow one is like kind of almost, and here it's not good. So why it's that? So the NCLEX is broken down in the 15 specific areas. 15, I made it here. And if you see here, each of them, they have a definition. And what does it mean, you know? And it's not just about knowing your content, it's about knowing how to apply it in different situations. So some people mention about certain people that they have that back doors that they can help some students, but I think the way they teach, it's those stimulation exams, questions, and explain probably in a student language exactly those definition and give you more specific examples. So I decided to do it for myself, and so for my past, I did very well on teaching myself. So I'm teaching myself, and I know it worked for me. So that's why I'm sharing with everybody. And if everybody thinks that helps them too, that's fine. If not, then it's fine too. Everybody has different way of studying. Everybody has their own tribe, a way to study, and I hope I can find a lot of people that they like the way I'm studying, and we can study together. So this is my goal. And here, this is the pie. This is from NCLEX, and you can see here the date. So this is the latest. Next year in 26, March, April will come a new NCLEX, and they will publish a new booklet, and probably they add more or not, but I think this is a very traditional one, because we all need to be with the patient and taking care of the patient. It's all about the patient. And so those domains, which includes the traditional A categories like management of care and psychosocial adaptation, plus the six steps of clinical judgment right here, which is a huge focus of this new exam. So by organizing your notes of around those 15 domains, which I do, and hopefully you do too, we can learn how it plays into the correct context for the exam. And I will give you examples like one of two, but in this booklet, it's one page about this, one page about this, one page about this, and this, so on and so forth. So, and then when you have a page and explain what it is there, you just write what you know. Everybody knows. If you've been through the RN school, you dream about those definitions and those labs and clinical sites where you do the practice. So it's just the technique on quiz taking, I guess. And this is the chapter 19, and this it's my 10 minutes that I'm always say 50 pages or 30 pages in 10 minutes. So 10 minutes is just to kind of have a glass, like an overview of what the chapter. So when I was reading those chapters, I would read, and then I will ask myself at the end, so, okay, I learned about this, about that, but how is this structure? So then I start divided. So every chapter has an introduction and an overview, and what are you gonna talk about it. And here it looks like it's two little overviews here, if you see. And then on the two, they talk about the primary and then the secondary, and then two more here. And if you notice that everyone has AP, patho, clinical, and then here interpersonal management, which also is the nursing care here that we do. So basically this chapter, you see in the primary has two, and then B cell has this and this, the T cell has this and this, and all of them, they have AP, patho, and in here, like, what does mean. And then here, this is a huge table that they talk about this. That's why I mentioned a table, but there are few words here. There's not much. Mostly they talk a lot about type 1, type 2, little bit of this, and very little of this. So moving forward, you see here, I'm always talking about the 50 domains, and you see what is the basic care here. So I'm going to talk always about basic care because I saw that everybody had a problem about this. So always now I'm focusing because might be some question tricky regarding this, right? So in this chapter 19 that they talk about the B cells, we talked about it, right? B cells, T cells, and then the secondary immune dysfunction and the hypersensitivity, right? So on the basic care and comfort, it's to provide nutritional support, tubes, feeds for D. George. So we have these, and do you know what is D. George? So it's from the T cell, right? And then comfort during infections. And then let's see, you reduce fatigue, pushing oral feeds in unsafe swallowing cleft palate. And you see, you need to know the growth milestone monitoring. So failure to thrive is a red flag. I think, remember, like when you have in NCLEX questions review, like to mimic, is that bone tie. They say bone tie, and then what the nurse think is the disease and how you implement and some action and what you know about it. So here might be this. And always we need to evaluate whatever you do for the patient or whatever you see at the patient. You assess, you scan. So sometimes we nurses, we have the eyes of a X-ray machine, literally, because you look from the head to toe. Always you know that a person has something going on. So even with the skin, nobody has a perfect skin. Everybody, this I learned in my LVN school, my RN instructor, we always say skin is perfect. Oh my goodness, she didn't like it. So my instructor said, is not such a thing. Everybody has a skin something. Either had an operation and is a scar. Did you measure where it's located? How it looks like? You know, this was a cut, was an incision, was a from a laceration, then was from staples. Can you see them? Oh my goodness. So many details. So moving forward. And here I have more little bit tricky ones, because I find out that some questions specifically from SATA, select all that apply, they have more than one category. So when everybody's scared of SATA, then just think about the keyword on the question, and or if you describe that question and where you look at it, and then you know exactly. And then I made this one, pharma. So you see, in keywords, in key terms, I talk about this, the IVIG. Actually, is the key term. So you see the EpiPen, adult, child. So let's go to basic care and comfort. We'll do like nutrition and hydration. So it's always, you see here again, the tube feeding. It's always important how we, and daily weight, daily. Maybe in the question, my meant some in options to select might say about weights, so be careful, because everything, when somebody has a problem with eating something that is related to nutrition, you need to think about the weight. Same like when some certain disease, some certain patient, they have edema on the cardio patient. So when they have edema, you need to wait daily. Okay. So we start with our famous 15 domains, because that is my goal for each chapter for the NCLEX. Management of care. So a child with X-linked agammaglobulinemia is admitted with fever and cough. So has a fever and cough. What we know about? So usually we think everything with fever and cough, it's kind of infection. Which room assignment is best? So you see, it says is admitted. So now this patient come into your unit. Where you going to assign this patient? Which room? In the semi-private room with another child on IV antibiotics. B, private room with protective isolation. C, room near the nursing station for observation. D, semi-private room with a child recovering from appendectomy. So think about, this person comes with fever and cough. If somebody comes into your home with fever and cough, what do you say? Just come over. And semi-private. So this person just recovering from appendectomy. So the dectomy, it's a key term, right? Appendicitis and removal. Do you want to put this patient with this person that is recovering from this? So here, another child on an IV antibiotics. Do you want to admit with this one? Do you want near nursing station for observation? Usually this is for Alzheimer wandering patient because you want to keep eye on. So let's see, which one do you think? I know you were thinking about this. So yeah, so you see immunodeficient patient, the XLA, no B cells, so require a private protective isolation to reduce infection risk. So the semi-private exposes them to another infection, you see, so okay. Safety and infection control. The nurse is preparing to administer vaccine to a 6-month-old with SCID, which vaccine is contraindicated. So do not give contra, right? You want to give a polio, you want to give hepatitis B, you want to give life attenuant, or you want to give the pneumococcal conjugate vaccine. Which one do you want? So if you don't remember this, go on the outline. I will talk more about this. So you will know more. So it's C. The live vaccines are contraindicated in T cells or combined immune deficiencies. Inactivated and conjugate vaccines are safe. You see? So, moving forward. Health promotion and maintenance. So it's whole health promotion, which finding in an infant most strongly suggests primary immune deficiency. A, 2 colds in 6 months. B, persistent oral thrush after 1 year of age. Fussiness during teething, and the mild diarrhea after the antibiotics. So it's health promotion and maintenance. So the persistent thrush after age 1. So you have to think this here, persistent. So worrying sign of immune deficiency. So you see, so this is the table. You go back and look on that. Occasional colds, fussiness, and antibiotic antibiotic diarrhea D are expected. You see the psychosocial integrity. An adolescent with the George syndrome express frustration about being different. Which nursing action is best? So somebody is frustrated and think it's different. So as a nurse, what do you think to do first? Oh, you're just fine. Usually those type of questions are, oh, don't worry, it's all good, you're just fine. No. Encourage participation in peer support groups, provide pamphlets about immune deficiency, So it's an adolescent. Think about it. Suggest the teen avoid discussing their illness. You see, as I said, like, oh, you're just fine. Or D, tell the teen, everyone feels different sometimes. So you kind of avoid the elephant in the room, right? So what we do it? So peer support group, foster coping and reduce isolation. So the pamphlets provide education but don't address the psychosocial needs. Avoidance from the C and minimizing feeling on D are non-therapeutic, right? On basic care and comfort of I was struggling. So the nurse cares for child with the George syndrome. So let's say I have in my care this child with the George syndrome who has feeding difficulties. Remember when I said about nutrition, which action is priority? So has feeding difficulties. So what action is priority? Allow oral feeding dispute aspiration risk. Collaborate with speech therapy for swallowing evaluation. Encourage high-calorie snack only. Offer liquids with solid food to improve swallowing. I think was obvious. So feeding difficulties in the George syndrome require interprofessional management, like speech therapy to provide aspiration. ACD can worsen the risk of aspiration. So usually in every hospital, and even in not just for children, for pediatric, but even for elderly, in any facility, it's there not just the nursing, not just the nurses and the CNAs. No, you have other members like speech, OT, PT. So these are the professional management. So every time when you see something with a patient, doesn't matter, you need to ask the doctor to give a referral, and then they go for an evaluation, and then every patient they need to have interprofessional management, the other stuff. So the speech therapy, everybody who has difficulty feeding or losing weight or aspiration at risk, even the stroke patient, they need to go through this, right? Moving forward, pharmacological and parental therapies. Okay, so usually in NCLEX they will give you some meds about it. And the pie is not that big, but you need to answer as many as possible. So the nurse teaches a client with XLA about the IVIG therapy. So teaching. Okay. Which statement shows correct understanding? IVIG, so the IV from IG, will permanently cure my disorder. True or false? I need this IVIG every 3 to 4 weeks to prevent infection. I should stop IVIG if I feel well. Stop? No. Live vaccines will protect me while on IVIG. I think this is very obvious. I think so. So the IVIG is a lifelong therapy. Every 3 to 4 weeks. It prevents passive immunity, not a cure. Stopping the therapy puts a client at risk. The live vaccines are contraindicated. So here the risk potential. Then the nurse reviews labs of a patient. So kind of this also, it's like this question, I feel like it also is a pharma. You see, so this has like double the points. For a patient with allergic rhinitis, which finding is most consistent? So you need to know the real value of this and what is this for, what is this for, and what this mean, and this. Usually every chapter they have those key terms and I explain these names. So 18 explain this, and chapter 18 also has that nice table talks, but also this chapter 19, it's reviewing, so they are back and forth and they can't see. So the correct answer is allergic responses. Eosinophilia normal can rise to 12. A low. C it's normal, and D it's anemia. Are not specific. Okay, psychosocial adaptation. A patient suddenly develops anaphylaxis. So, do you know what this means? I talk about in the key terms. After IV antibiotic infusion, what is the priority action? Okay, so you give an antibiotic to this patient, and now you see making all those movements and see that it's changing everything. So what do you do about it? You administer IV, you administer the intramuscular, place patient in this position, like no, for sure. Give corticosteroids IV, but why? Why is this for? You have to think about. So correct answer is, so it's the intramuscular. Epinephrine is the first line in anaphylaxis. So the antihistamines and steroids from A and D are second line. Does not improve airway. You see, so you have to think that the patient is at risk and what is your priority. So we're in clinical judgment. A patient with gut posture syndrome presents with hematuria and shortness of breath. Which system is the nurse most concerned about it? Okay, has this syndrome, and then hematuria, what this means, and shortness of breath. So what this keyword means and what this means. So why the nurse is the most concerned about it. Neuro, it's here about neuro. It's renal. Maybe, let's see. Let's see, I don't know. Let's see. It's maybe because it's urea. Musculo, why? Because it's short of breath. The skin, why? So it's not. So you see, it's the renal. So the good postures affects the kidney and the lungs. So renal failure, pulmonary hemorrhage, neuromuscular integrity are not primary. So these are kind of like when sometimes you guess and you have no idea, then because you see it's clinical judgment, you see like which system is the nurse most concerned about it. So basically you have to do your own clinical judgment, your critical thinking. Let's see, you don't know this, you kind of know what's this, and you kind of know this one. So you kind of start to eliminate. Okay, recognizing cues. You see, we are in 10, so we have 5 more to go. I should get going faster. The nurse assesses a patient with suspected transfusion reaction. Which finding is the most concerning? So I have this patient that I suspect has a transfusion reaction. So what I'm concerned about the most? Rash and itching, fever and chills, back pain and hemoglobinuria, or headache? Headache? For sure not. See. So the back pain and hemoglobinuria, it's the hemolytic transfusion reaction, which is a life-threatening. So those ones, they are a little less because rash and itching, fever and chills, so you can treat. But here, that it's because it says here most. So also you have to think, okay, I have no idea, and now I'm most concerned. Rash. Is rash about fever and chills? Is this one's more than this? So this is kind of, you try to kind of guess also. You see, it even says here, recognizing the cues. Here, analyze cues. So now I have to analyze. A patient with DIGER syndrome has a positive and these signs. Chevostek and Trousseau signs. What is this and what is this? Key terms. What does the nurse suspect? You see here, okay, hypo, 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 hypo. Everything is low, but think those keywords, they are positive. Kalemia, calcemia, natremia, magnesemia. So think, what does have to do with this? So these are the labs, you see, and analyze the cues. You see, so kind of pharma here from that pie. So it's B, calcemia, because if you know this, you will have the cue of this. So the hypoparathyroidism, you know, the hypo, low, parathyroidism, wrote this. So you have to think, what is this related to? It's hypocalcemia. Tetany positive on Jevostek and through cell signs. I think this is easier because I see that many people they don't have an issue on prioritized hypothesis. So here is a child with SCID is hospitalized with pneumonia. Which hypothesis? It's so relevant. So the takes priority. Risk for impaired skin integrity. So if you notice, this is the nursing diagnostics. Risk for impaired skin integrity, risk for delayed growth and development, ineffective airway clearance, disturbed body image. So pneumonia takes priority. So it's C, airway and oxygenation take precedence over long-term concerns. Generate solution. A nurse cares for a patient with a severe latex allergy. Which intervention is the best? You see, it's latex allergy. What do you do about it? Which intervention is best? Use powder-free latex gloves only, use vinyl or neoprene gloves, double glove with latex gloves, schedule surgery later in the day. It's B. So use the vinyl or neoprene gloves. Why? Because prevent reaction. Expose patient to latex. Delay care is not a prevention. Take actions. The nurse is caring for a patient with serum sickness after penicillin. Which action is appropriate? So you need to know. So here it's the take actions, and this is kind of a way to know they come together. And then, okay, which action is appropriate? Administer epinephrine first, administer antihistamine and corticosteroids as ordered. Place patient in protective isolation, encourage fluids only. So we go with answer B, administer the antihistamines. So the symptom management, it's antihistamines plus corticosteroids. Epinephrine only for anaphylaxis. Isolation is unnecessary. Fluids don't treat reaction. Yoo-hoo, we made it to the last. Evaluate outcomes. We always, what we give, we need to evaluate. So this patient with IVIG therapy for XLA states, I have not had pneumonia since starting treatment. That's good. How would the nurse interpret this? The treatment is ineffective. The treatment provides short-term passive immunity. The patient should stop therapy. Should. The patient will no longer need antibiotics. So the IVIG provides short-term passive immunity, reduce infection. It is not a cure, right? So now it's time for me to check out and to see you in the next episode. I hope this video was what you look for, and checking out and telling you my last thanks and thoughts for this video.
Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing students who might need this too. Everything we cover connects back to the real nursing, wherever it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.